Our next three speakers are, I believe, Roseanne Taylor's either students or ex-students, which is a thrill for us, and we'll be very interested to hear them. The first person is going to be Boning Zhu. Boning, would you like to share your screen with us?
Yeah, sure.
Okie dokie. And Boning is going to tell us about the prevalence and risk factors of common dermatologic disorders in the English Springer Spaniels in Australia. Boning is, of course, associated with the University of Sydney. Boning, over to you.
Thank you. Hi, everybody. My name is Boning, and I'm from the University of Sydney. And today I will present my study in the risk factors of common dermatological disorders in English Springer Spaniel of Australia. So English Springer Spaniel is one of the most popular breeds owned by Australian people. They are friendly, happy, and medium-sized dog. They are known by their significant appearance, which is the lobulous ear with good length and width. And there are 3 breed standard colors, including black and white, liver and white, and tricolors. But also they are some studies has investigated like they are also at a high risk of getting some common dermatological disorders, including the ear otitis externa, skin hypersensitivity, malassezia, and primary seborrhea. And a lot of study has investigated on otitis externa, and they conclude that risk factor is include primary dermatological disorders like atopic and seborrhea, and some secondary causes, including bacterial infection and yeast overgrowth. And one study I find they actually find that spaniel type, because of their ear conformation, is actually pose them to a higher risk for otitis externa too, and also some other demographic factors, including their overweight or neutered. And also another study also say that skin hypersensitivity is also be proven is one of the underlying cause of malassezia dermatitis. Skin disease, especially those psoriatic one, like atopic dermatitis, will greatly impact the quality of life for both pets and owners. However, there is information gap in Australia of reliable epidemiological studies, and it will limit the evidence for veterinarian to educate their client. Therefore, the aim of this study is to investigate the prevalence of some common dermatological disorders presenting to the primary care veterinarian clinics, and also to identify the disease risk factors by analyzing electronic patient records from the VetCompass Australian database. So the study I use is Prevalence study. Basically, I retrieve all the electronic patient records of patient identified as English Springer Spaniel in 2017. And then they will be cleaned to remove all the records without a date of birth or some repetitive records, and then code with Venn code. And then when I code them, I will use the case definition criteria. They either need to have clinical signs or confirmed diagnose from the vets, or they need to have a supportive diagnostic test results, or they've been prescribed with medication that's treating this disease. And then all this data will be summarized and analyzed in R and be visualized. So in the end, I actually include 1,428 records from 295 individual patients. And here is the demographic summary. Also, to better analyze, I further categorize them based on the age of their last consultation into 4 groups, and then use their average annual weight to categorize them into 4 weight group. But I exclude all the puppies just because their weight is pretty unstable during the first year of their life. So at the end, I only include 92 adult female and 99 males. when I categorize them into the weight group. And then, so after that, I find out the top 2 prevalence dermatological disorders for English Springer Spaniel in 2017 was otitis externa and malassezia overgrowth, both otic and dermatitis, like otic malassezia and malassezia dermatitis on the body. And then I also run the univariate and multivariate general linear regression model to identify the demographic risk factor. For otitis externa, the overweight and age, older age is the most significant too. For malassezia, only the age is the most significant factors. And for skin hypersensitivity, there is no demographic factors being significant enough. And just because overweight is one of the important risk factors, so I also did a linear regression model for them. And then the neutral status is, and actually the color are the 2 most significant risk factors. And at last, I find that the dogs with skin hypersensitive, no matter that's food allergic or just atopic, they pose a higher risk for malassezia overgrowth and otitis externa too. And then in discussion, I find that like English Springer Spaniel in Australia, they actually have a higher incidence of otitis externa, which compared to the previous study in the UK and also in Finland. And second, English Springer Spaniel in Australia, it has more frequent otic malassezia overgrowth compared to a study in Israel. And they have a similar prevalence of malassezia dermatitis compared to another UK study. And then also compare with one of the general health VetCompass studies done in 2021 in UK. English Springer Spaniel in Australia actually have a higher risk of being overweight. And at last, skin hypersensitivity, it will also increase the malassezia overgrowth and otitis externa. And here is the risk factor identified in this study. And actually one funny thing is I find that cold color is actually been investigated as one of the risk factors for overweight, which has never been found in other study before. And then, but there's also limitation of my study. One of the most prevalent, obvious limitation of my study is the pro data entry from the veterinarians, because they will use a lot of abbreviation and simplified description, which will cause misunderstanding and challenge in categorizations. Even though I also like double check with my supervisor Roseanne, but there could be something we missed together. I think that could be caused by like using venom code could be extra time spending, especially when you're not familiar with them. Even it's embedded in some of the veterinarian management software too. And there is a lack in venom code for some specific sign, especially in my study. I find a lot of vets will mention like skin redness, erythema, but there's no related venom code for that. And also the thickening of skin hyperkeratosis, there's also venom code for that. So I have to make my own one in my study. And then as conclusion, my study could be the first comprehensive health survey about otic and dermatological disorders for English Springer Spaniel in the Australia. And also my finding of this study can be used by veterinarians for disease surveillance and management, especially after we know that overweight and older age could be pose a higher risk for some dermatological disorders. Our vets could like remind their owners to take care of these when they are in their daily life of taking care of their dogs. And also the limitation of my study also could like give us a recommend, maybe we can emphasize on the record keeping, especially in veterinarian education. So like if we have a good record keeping, it could help with our future epidemiological studies, and it could also provide a very good evidence, especially in the investigation when you're facing a client complaints raised by veterinarian practitioner board. And here's my reference, and thank you everyone for listening.
Thank you, Boning. Has anyone any questions? We have a question from Roseanne. Do you think weight management might offer promise for improving the health of English Springer Spaniels in Australia? For example, using VetCompass data, is it likely to be a finding that might be repeated in other breeds?
Yeah, it could be, because my study is only about English Springer Spaniel, but actually a lot of dermatological study I find actually is like more studying like a general breeds, not only the English Springer Spaniel, and overweight is actually a very common risk factor for otitis externa. So we probably could also like conduct some study, especially for otitis externa among other breeds too. So maybe the result can also help with other breeds and help and have a better evidence for our vets to recommend like weight management for those patients that has like probably chronic otitis externa.
Right. Thank you, Bonnie.